This video is for educational purposes only and is not medical advice. Always consult your healthcare provider about any symptoms or concerns. Can this medication cause mucus in my stool? If you're taking Tirzepatide and notice mucus in your stool, you might be wondering if the medication is causing it. Let's talk about what we know and when you should reach out to your doctor. Tirzepatide, which you might know as Mounjaro or Zepbound, is FDA approved for type 2 diabetes and chronic weight management. It's a dual GIP and GLP-1 receptor agonist, which means it works by enhancing how your body responds to meals and slowing down how quickly your stomach empties. That last part is important because it's why digestive side effects are so common with this medication. Here's the bottom line. Mucus in stool is not listed as a recognized side effect of Tirzepatide in the FDA prescribing information. However, the medication does significantly affect how your digestive system works, which could theoretically make intestinal mucus more visible. Your intestines naturally produce mucus to help things move along smoothly, but when your digestive transit time changes, you might notice it more. What we do know for certain is that Tirzepatide commonly causes gastrointestinal side effects. Nausea, diarrhea, vomiting, constipation, and abdominal discomfort are all well-documented reactions. These happen primarily because the medication slows how quickly food moves through your system. In clinical trials, these digestive issues were significant enough that about 4 to 7% of participants stopped taking the medication because of them. These side effects tend to be most noticeable when you first start the medication or when your dose is increased. It's also worth knowing that mucus in stool can result from many conditions completely unrelated to Tirzepatide, including irritable bowel syndrome, infections, or inflammatory bowel disease. That's why it's important to have your healthcare provider evaluate any persistent changes. So if you're noticing mucus in your stool while taking Tirzepatide, what should you do? First, understand that changes in bowel habits and stool characteristics can happen because of how the medication affects your digestive system. The altered transit time might make you more aware of things you wouldn't normally notice. That said, there are definitely times when you need to contact your healthcare provider right away. Seek immediate medical attention if you experience severe abdominal pain, blood in your stool, black or tarry stools, fever, right upper abdominal pain with fever or yellowing of your skin or eyes, persistent vomiting that prevents you from keeping down fluids, or signs of dehydration like dizziness or decreased urination. You should also reach out if you notice unexplained weight loss beyond what's expected or severe pain that radiates to your back. These could indicate something more serious that needs prompt evaluation. Even if your symptoms aren't severe, it's worth discussing any persistent changes in your stool with your doctor. They can help determine whether what you're experiencing is within the expected range of digestive changes or if it warrants further investigation. When you talk to your healthcare provider, they can discuss strategies for managing digestive symptoms. This might include dietary modifications or other supportive measures. Your clinician may adjust your treatment plan if needed, but don't change how or when you take your medication without their guidance. Your doctor knows your complete medical history and can give you personalized advice based on your specific situation. It's also important to be aware that Tirzepatide carries a boxed warning for thyroid C-cell tumors and isn't appropriate for everyone, particularly those with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Remember, any new or concerning symptoms should be discussed with your healthcare provider. They're your best resource for determining what's normal for you and what might need additional attention. So here are your key takeaways. Mucus in stool isn't a recognized side effect of Tirzepatide, but the medication's impact on your digestive system could theoretically make intestinal mucus more noticeable. Digestive side effects in general are very common with this medication, and most importantly, contact your doctor if you have any of those severe symptoms we mentioned, or if you're concerned about any persistent changes. Have you experienced digestive changes while taking Tirzepatide? Let us know in the comments what questions you have, and if you found this helpful, give us a like and subscribe for more evidence-based health information.